There was this interesting piece that I heard that racism affects your health. Now I want you to go ahead and hear this clip.
Let's turn now to a related topic. Most people can acknowledge that discrimination has an insidious effect on the lives of minorities, from being passed over for jobs to being shut out of desirable housing. Most people are painfully aware of the tensions between African Americans and police. But discrimination can also lead to a less obvious result: tangible, measurable, negative effects on health. A new survey conducted by NPR, the Robert Wood Johnson Foundation, and the Harvard T.H. Chan School of Public Health asked members of different ethnic and racial groups about their experiences with discrimination. Among African Americans, 92% said they believe discrimination against African Americans exists today. More than half reported being discriminated against themselves. And all of this can be deadly, according to Harvard University public health professor David Williams, who spent years studying the health effects of discrimination and talked to us about his findings.
Well, basically what we have found is that discrimination is a type of stressful life experience that has negative effects on health similar to other kinds of stressful experiences.
Can you just give us one scenario where it would lead to a tangible, measurable effect on health?
The research indicates it's not just the big things of experiences of discrimination, like being passed over for a job or not getting a promotion that someone felt they might have been entitled to. But even the day-to-day little indignities, being treated with less courtesy than others, being treated with less respect than others, receiving poorer service at restaurants or stores. Research finds that persons who score high on those kinds of experiences, and if you follow them over time, you see more rapid development of coronary heart disease, the number one killer in the United States, by looking at what is actually happening to the arteries and the narrowing of the arteries. That occurs more rapidly among persons who report these day-to-day indignities of discrimination than persons who score low on those measures. That's just one example. Another example would be research finds that pregnant women who report high levels of discrimination give birth to babies who are lower in birth weight.
You know, our poll also found that almost a third of African Americans said that they've experienced racial discrimination when going to the doctor. Could you talk a little bit about that?
Sure. That data is quite consistent with something that we in the medical and research community have known for some time, that across virtually every medical intervention, from the most simple medical treatments to the most complicated treatments, blacks and other minorities receive poorer quality care than whites.
Now, I can imagine that some people hearing our conversation might argue that this is really about class, not race, that this is a function of socioeconomics. But you've specifically studied this question. What have you found?
There are in the United States striking differences in health and in access to health care by income and education and occupational status. But what the research finds is there still is a negative effect of race at every level of socioeconomic status. So that African Americans who are college educated, for example, do more poorly in terms of health than whites who are college educated. And these racial differences in the quality and intensity of care persist for African Americans, irrespective of the quality of insurance that they have, irrespective of their education level, irrespective of their job status, irrespective of the severity of the disease.
Professor Williams, you've been studying this for quite some time. Does your research indicate a solution? I think one might assume that most medical professionals don't think that they're discriminating against Black people.
Yes, that is a really important point. We think the majority of the discrimination that occurs in the healthcare context is driven by what we call implicit bias or unconscious, unthinking discrimination. If I am a normal human being, I am most likely to be prejudiced. Why? Because every society, every culture, every community has in-groups and out-groups. And if there are some groups that you have been taught, just subtly, as you were raised, to think of negatively, you will treat that person differently when you encounter someone from that group without any negative intention on your part, even if you possess egalitarian beliefs. And the first step to addressing it is to acknowledge it could be me.
That's David Williams. He's a professor at the Harvard T.H. Chan School of Public Health. Professor Williams, thank you so much for speaking with us.
Well, that's some good information. And we know as Black people every day, we're dealing with a lot of stress, if anything, dealing with racism. You know, the stress, and you feel your blood pressure raise when you're pulled over by a police officer, or how you can get extremely aggravated when you notice that you're being treated differently, or, you know, how annoyed you can get, people following you in the store, or you blatantly see the racism that's in this nation, or how they make a difference with you versus Caucasian people. But at the end of the day, you still are stressed. You know, you still want to make ends meet. You're oppressed daily with this system. So yes, it definitely could have a health effect. And that's why they state that Black people don't live as long as Caucasians. Why? Because they deal with stress. And we know stress can kill you. Stress can put you in the ground. Stress can give you a stroke, heart attack, etc. So, you know, I definitely agree with this, that racism can cause health effects. Now, what could we do to alleviate that? Have a knowledge of self, stand up against it, because I noticed that when you stand up against it, it doesn't have the exact same effects as it would if you were just taking it all the time. And those who would try to oppress you, they notice when you are awake, and they also notice just the way you speak, and they're not going to come at you the same way. And that could alleviate it just a little bit for you. I'm not saying it's going to completely disappear. Also, building an economy for yourself, promoting and creating schools, doing all the things that you can to do for yourself, because we know in these schools how they attack our children for their hair. They attack them and try to put them in special education when they just don't try to teach these kids the right way, and the kids are bored, so they act out. That's really what it is. They don't care about our children, so they put them in special education. You know, banking. Sometimes how the banks will treat us, and we start banking with our own in our community a little bit more, then that's, you know, things that we can do to help alleviate it. That we have to start doing more within our own community. Just like other groups have their own things in their community, we need to have our own. See, the problem is that we keep going to these folks for everything, and they clearly showing you they don't care about you like that. And that's why we run into the problems, because nothing these people could tell me to make me think different, because how you treat me is what I'm going to take. I'm not going to take your words. So we need to focus more on doing for ourselves. And if we can do that, we can alleviate these problems that you're hearing in this piece. So leave me a comment. Let me know what you think about this. Share the video, like the commentary. Make sure you subscribe to this channel and click the notification bell for more commentaries.